Hello everyone, I'm Paul Harris alongside my co-host Dennis Brothers, filling in for Harvey Elwood, and this is New Perspective right here on the People Station, 93.7 FM, and today we are joined by Angela Hampton, who is a part of the Neuopathy Treatment Center. Ms. Hampton, how are you doing today?
I'm well, thank you.
I want to get right into it. Tell us, what is neuropathy? Because I'm not familiar with the word. What exactly is it?
Well, neuropathy is actually a disease of the nerves, also an abnormality of the nervous system where the nerves are not communicating in the way that they should. And it's caused by several different disease states. The number one in South Carolina being diabetes, because we know we have a large diabetic population in South Carolina. In fact, South Carolina is number 4 in the nation as far as diabetes is concerned. So neuropathy is caused by diabetes as well as thyroid problems and various other modalities.
Now, is this something that is rare? Because you say it's caused by diabetes and other things. Is this something that is very rare?
It's quite common, simply due to the fact of the amount of diabetics that we have in the state. It's also caused by chemotherapy or radiation, as well as some vitamin deficiencies. Medications can cause it, as well as sometimes organophosphates, which is used in fertilizers. We have a large farming population in this area. And that can also cause some of the neuropathy. And then sometimes we just don't know what causes it.
Ms. Hampton, could you tell us a little bit about your position with the Southeast Neuopathy Center?
Yes, I am the physician assistant there as well as lead provider. I work under Dr. Michael Gibson, and he's our medical director. And I am the one that you will see when you come in for your free consult, as well as the one that will be performing the treatments.
And what does the treatment consist of, if you don't mind us asking?
Well, basically, we bathe the nerves in an anesthetic, and then we will apply a neurostimulator called a TENS unit. And that TENS unit acts to wake up those nerves or stimulate those nerves to get them working on the same page.
Now, you mentioned that diabetes is one of the main causes. What are other causes that might be, can alcohol and drug related problems?
Definitely. Alcohol can cause what we call alcoholic neuropathy. There are certain disease states such as HIV, which can also cause neuropathy. Again, treatments of certain cancers that uses chemotherapy, medications, or even radiation can contribute to neuropathy, as well as thyroid and certain vitamin deficiencies.
Now, talking about treatment, what's the projected time of how a treatment should last for someone that has it?
Well, our particular treatment consists of 16 total treatments for a period of about 8 weeks.
What symptoms should people look out for if they are possibly diagnosed with neuropathy?
Well, most of the symptoms include numbness, tingling, burning, pain, muscle cramps. You may have weakness, cramping in the toes, feet, or the hands. You may feel pins and needles, creepy crawly feeling a sensation that something is on your skin, but you look and there's nothing really there.
But basically you said this is like the second stage, because you can have diabetes first and then you can get this?
You know, right now they are looking at it possibly being a precursor, because for some, they start with the neuropathy symptoms, the tingling in the hands or the feet, and then years later they are diagnosed with diabetes.
Okay, and I know, Ms. Hampton, we earlier off air I was asking you about the different nerves about neuropathy. So could you explain to us what are the different types of sensory nerves?
Sure. Most of the treatment that we do pertains to the sensory nerves, which are those that receive the hot, the cold, the pain sensations, the pressure.
Okay, and we know that motor nerves. Could you explain to us what are motor nerves?
Well, the motor nerves are the ones that actually control the muscles. They innervate the muscles and they will control the movement of the muscles.
Now, with treatment, most times there's consultation involved. Do you offer consultation with these if someone has neuropathy?
Yes, we are Southeast Neuropathy and Treatment Center is dedicated to promoting the wellness and higher quality of life for those that's living with the effects of the pain and discomfort. So we do offer a free consultation for you to come in. There will be no charge for that, for you to come in. And then if we see that upon further questioning and obtaining your history that there may be some neuropathy involved, then we will proceed from there.
And something that caught my interest on the packet that you gave us, it talks about the different causes of neuropathy, but right here it says antibiotics. So how can that, cause neuropathy?
It's only certain antibiotics that can cause that. It's a certain category that's more prone to do that. Your floxins, your levofloxacin and your ciprofloxacin, those have been known to contribute to that. But it's rare. Those are rare.
How often do you have people come in every day to get tested or to see if they are someone with neuropathy?
We usually have at least 10 consults a week come in for that.
Okay. And is it something that frightens them because it's a disease? Is it something that frightens them? Is because I know the consultation is what they do. But is it something that frightens them a lot?
Definitely. When you have those symptoms going on, a lot of times it affects your quality of life. And the number one thing is the sleep. They're not able to get sleep because their feet are constantly burning, they're tingling. Some people have to sleep in a recliner when they come to us. And now, let me just preface this by saying there is not a cure for neuropathy at this time. Right now, your primary care, your neurologist may give you medications to kind of help with the symptoms. However, we all know when you take medicines systemically, they can have other side effects also. So we don't manipulate those medicines at all with your primary care. In fact, we have our patients come in twice a week, and we emphasize, especially if they're diabetic, their blood sugar control. So that way we get more touches with them than their primary care, who may only see them once every 3 months. We emphasize and reiterate what the primary care does as far as diabetic control, thyroid control, making sure they take those medicines or the actual underlying cause of what that neuropathy is.
So basically, and I'm not trying to scare anyone out there, it's something that you can maintain. It's not something that goes away, but you can
and hopefully reduce, stabilize and reduce some of those symptoms so that they're able to sleep at night. I've had one patient that wanted to get out there and start playing golf again. He can't play the 18 holes, but now he's able to go out there and do 9.
So it does really weaken you a lot. Does it do it over time or?
Exactly. It's something that comes on. Some people is gradual, and it depends on the cause again. Some people is gradual onset, and some people is a sudden onset. It just really depends on the cause.
And because you said that, I don't know if y'all realize that, and I know this is sort of off topic to what this is, but when you said it's gradual, it reminds me of Alzheimer's, I think, with a lot of people, how you can first not know it can be, moderate, then it just goes gradually up to worse, and then it gets severe. So it sort of goes in hand. Just like Paul said, you're not trying to scare anybody, but what are some things that you could probably tell those that probably are dealing with neuropathy how to maintain it, like certain foods or something to try to low down, to try to not make it so high, I guess is what I'm trying to say.
Well, the number one thing is to treat the underlying cause. If we can find the underlying cause, if your primary care or your neurologist has found the underlying cause, if it's the diabetes, keep your blood sugars under control. If it's your thyroid, make sure you're taking your thyroid medicines as directed. Of course, with chemotherapy and radiation therapy, you have to do those things. So we would just have to treat that along with it. But then there are certain foods and vitamins that are recommended, like your B12 or a good B complex is nourishment to your nerves.
We're here with Ms. Hampton. We're going to wrap her up in a couple of seconds after a couple quick questions. One thing is Is this something that is hereditary, that can be hereditary? And also, is there an age you have to look out for this? Can you get it when you're young, or does it appear when you're middle-aged or old?
Our population runs the gamut of 20-year-olds up to 80-year-olds.
Okay.
So it's not necessarily age specific. It does tend to be in adults, though.
Is it hereditary, or?
We have not found a hereditary incidence with peripheral neuropathy.
Ms. Hampton, one quick question that I think we forgot to touch on. What is the number that we could contact you in case we want to get more information, our listeners out there?
We are at Southeast Neuropathy, and our phone number is 803-937-6843, or toll free is 844-209-3114.
Could you repeat that one last time?
For Orangeburg, it is 803-937-6843. Toll free is 844-209-3114. We are also on the website at southeastneuropathy.com, and we do have 3 locations. In case you're not in the Orangeburg area, we have one in Sumter, as well as our main office is in Columbia.
And where are you located in Orangeburg?
We are at 1737 Village Park Drive in Orangeburg, which is the medical village where the big clock tower is off of St. Matthews Road.
Right, so if you're not familiar with the area, it's kind of near Hillcrest on St. Matthews Road, like she said.
Ms. Hampton, thank you so much for coming in and explaining to us what is neuropathy and getting us aware, listeners as far as, and the host too, and coming to tell the station about what is neuropathy and some things that we need to be on the careful and how to look out. Ladies and gentlemen, I am Dennis Brothers and Paul Harris, and we would find it robbery if we did not recognize our proud sponsors of this production: the Regional Medical Center, Jameson Pharmacy, the National Kidney Foundation, Orangeburg Consolidated School District 5, Jimmy Jones Toyota of Orangeburg, Office Depot, Office Max, Macmillan Dental Care, and Nissan of Orangeburg. Ladies and gentlemen, have a great day.